It all started in March of 1918. Private Gitchell, a cook at Camp Funston in Fort Riley, Kansas, was the first patient to contract influenza. This case would commence a continuous outbreak that would later become the deadliest strain of influenza in history. The global movement of soldiers during World War I caused American soldiers to exchange the illness worldwide, which led to a high number of people acquiring the illness in 1918. The encounter caused American scientists to explore new ways of preventing viruses and responding to future outbreaks.
Before the influenza pandemic of 1918, scientists had little information on how to treat the flu virus or how it was caused. Although there were many outbreaks before the 1918 pandemic, more extreme outbreaks in the 19th century motivated scientists to research influenza. In their research, they concluded that illnesses are caused by microorganisms. In 1892, one specific scientist, Richard Pfeiffer, came to the conclusion that influenza is caused by a bacteria, later known as Pfeiffer's bacillus. It was until the 1918 pandemic that scientists all over the world believed in his theory.
When the pandemic arrived, workers learned how to cope with influenza. The encounter of new waves of influenza caused healthcare providers to fall ill, leaving no one behind to care for the inflicted. One doctor at Camp Devens in Boston, Massachusetts, wrote a letter to his friend explaining how the pandemic was affecting the camp soldiers and doctors. He described how rapid people developed the vicious pneumonia, along with cyanosis, which caused men to be unrecognizable. He stated, "It was only a matter of a few hours until death comes, and it is simply a struggle for air until they suffocate. To see these poor devils dropping like flies sort of gets on your nerves."
It killed more Americans than all the wars this century combined.
It was a phantom, and we didn't know where it was.
In a gradual, remorseless way, it kept moving closer and closer.
You never knew from day to day who was going to be next on the death list.
There were so many people dying that you ran out of things that you'd never considered running out of before, caskets.
Before it was over, it almost broke America apart.
Scientists only knew how to treat the illness as a bacteria, so vaccinations and treatments were ineffective. Doctors and officials tried everything they knew, from home remedies to no-spitting laws. Popular newspapers warned people about the influenza, but there was no helping it. People thought the flu was so contagious that by simply opening windows in a house, they would become ill. A common rhyme sang by children during the pandemic helped them understand the dangers of the flu.
I had a little bird, its name was Enza. I opened the window and influenza.
As World War I progressed, soldiers were bringing the flu to areas that otherwise would have not been affected. The trenches that soldiers were fighting in were perfect breeding grounds for the virus. Also, technological advancements in transportation allowed the perfect atmosphere for influenza to spread. Health officials and the general population were not overly concerned about the havoc that the illness was causing until September of 1918. This was when the illness mutated and resurfaced in major cities such as Freetown, Sierra Leone, and Boston, Massachusetts.
On November 1st, 1918, the Stars and Stripes, the official newspaper of the American Expeditionary Forces, stated, "Influenza as an epidemic runs a course approximately 2 months, and the second wave that has struck the forces is now almost at the end of its 2 months course." About 1 month later, the same newspaper wrote, "It was hot coffee, thousands of gallons of it, that ended the deadly epidemic in the dark autumn days when that disease was working ravages among American troops en route to France."
Once the flu had begun to dissipate in the spring of 1919, scientists immediately began research to try and understand the illness. Researchers started with the basic information they knew about the disease at the time. It was caused by bacteria. In their research, they found out that the previously suspected bacteria were not the cause of the flu after all. It was until 1933 that physician Richard Shope discovered, through research on infected pigs, that a virus, later known as influenza A, was the primary cause of influenza, not bacteria. The belief that the flu was caused by a bacteria had prevented scientists from producing a vaccine or medication during the course of the pandemic.
Scientists kept progressing towards medications and vaccines, but as it did, the virus kept mutating. In 1940, influenza B virus was isolated, and in 1950, influenza C virus was isolated. Reluctantly, in 1945, the United States licensed the first influenza vaccination that would help prevent and control future outbreaks. Over time, the vaccines became stronger and more effective. The Centers for Disease Control and Prevention states, a longer-term goal for the flu vaccine is the development of a single vaccine that would provide safe, effective, and long-lasting immunity against a broad spectrum of influenza viruses, both seasonal and novel.
The influenza pandemic of 1918 advanced into the extreme levels it did due to troops transporting across the globe in World War I. If the United States had not been involved in the war, it would have been less likely for the pandemic to have spread in such great numbers in multiple continents. The world encounter with a deadly strain of influenza caused American scientists to explore new microorganisms and produce vaccines, preventing future disasters from occurring. Many researchers still believe another aggressive exchange of influenza could strike any time. As long as the influenza keeps appearing year after year, scientists will continue working for an absolute way to prevent the fatal virus from attacking once again.